Baggy eyes, puffy eyes, eyes where you feel that you have hollowness, or people keep telling you that you look tired in spite of you not being tired. If you have any of these issues, this is a video that you should see. Hi, I'm Dr. Saumil Shah. I am a plastic surgeon, director of plastic surgery at Skinzone Aesthetics in Borivali, West Mumbai. First, the most common thing people present to us with at an older age are baggy upper eyelids and a lot of wrinkling and baggy lower eyelids. Second, that young people present to us along with what older people also have are big bags under the eyelids. This may be without loose skin or with a lot of loose skin as well. Third, the most common problem that people present to us are with dark circles under the eyes, and these are mostly in the young to the middle age. All of these three problems have three different causes and all cannot be treated the same way. In fact, the dark circles themselves can have different reasons for them happening. So let's dive deep into why these problems happen and what are the solutions we can find for you. As you get old, what happens is that the brow sort of falls with gravity. Also, this area falls and becomes a bit hollower. Sometimes you may even have bulging there with like bags, but most of the times it becomes hollow. The skin over there, because the brow falls, becomes excess and that too starts falling. You lose elasticity and the strength of your skin, and that's why the wrinkles start forming and it just falls on your upper eyelid. This sometimes can cause problems with even vision, where people have difficulty opening the eyelid completely. In the lower eyelid, it often presents starting with wrinkles on the side of the face that become bigger, going to the underneath your eyelids, and then a quite frank laxity where the eyelids cannot sort of just stay there. If you want to know that if your skin is lax over there, a very simple test is just pull your eyelid there. If it does not go back immediately, then it has lost its elasticity and it may need treatment. Eye bags are something that are very common. People mistake it for a lot of different things. Eye bags can be in the upper eyelid or even in the lower eyelid. These eye bags can be in young people or in older people. In young people, it's usually genetic and they would have had it since even their teen years. In older people, usually it develops with age. Both of these things may also have a component of swelling of water accumulation in it, and that is when you have a complaint where the eye bags become bigger in the morning and smaller in the evening. Now these eye bags are basically nothing but fat that is protruding through the skin or through that area. What happens is that an eyeball sits in the bony socket of our skull. To protect this and cushion this, it is surrounded by fat. With time, this fat sort of just collapses with gravity or comes down with gravity, and the structures in the front of our eyes, which are like a curtain that is sort of pushing or keeping this back, also loses its elasticity and it pouts out, and that is what causes these eye bags in older people. In younger individuals, they have sort of a laxity of these areas. Genetically they are predisposed to it, and so they start having it at a much younger age without even losing the elasticity of their skin. Dark circles. Now these are a little more complicated. Dark circles can be because of increased pigmentation in the skin. 2, it can be because of increased laxity in this area that is basically causing the skin to gather and look darker. Third, and the most common reason for it, is basically there is hollowness in this area. And one more reason is that you may have a very thin skin over here, because of which the underlying darker muscle is making it look that way, or even the increased blood supply or the increased vascularity, as we call it in medical terminology, is making that area look darker. Now each of these will need a different solution. The hollowness itself can also be because of aging, where the rest of your face fat pads or rest of your face fat is sort of sagging with time. Each of these conditions will require a different treatment. In our next video, we'll talk about the different treatments for each of these different conditions. So do join us there.